All right, welcome to another episode of Medicine Mondays. Yours truly, Dr. Pierre, and we are going to continue the momentum of educating our community on making the right choices. We talked about Obamacare and its extreme importance of it. We've talked about making sure we take advantage of our preventative health services that our insurance plans are covering, typically at no cost. But I want to go back just a little bit, just a quick rewind to make sure we got our foundation set, right? Because someone asked me, on one of my social media platforms, like, hey, well, that's cool and all, but how do you make sure you got the right insurance? And how many of you had to ask yourself, like, do I have the right insurance plan? And I think that's an important question because a lot of times, typically when we're looking for insurance coverage, a lot of times our focus on, all right, what is the premium, aka how much do I got to pay every single month? And I'll be honest, that is a very important question, but it's not the most important question, especially when you're talking about health insurance. And I can assure you that those who have health insurance and have ran into the roadblock of, oh, you don't cover that, I will tell you very quickly that the amount they pay per month was the last thing they were thinking about when they realized that the insurance plan that they have been paying, pretty consistently every month didn't really cover much, right? So I'm going to be talking about health insurance, making sure we are making the right decisions on our health insurance plan, because it's obviously extremely important to make sure we're making the right decisions and make sure that we're asking the right questions, especially when we have health insurance. Because I know a lot of people who have health insurance and don't realize how to take advantage of it. Like, I could tell you, hey, do your preventative service plans, make sure you're getting your wellness checkups. That's cool. But there are a lot of other things that if you don't know, you can be taken advantage of, especially when we talk about health insurance. Because unfortunately, health insurance is a business, and their business is to not pay. Let's just be honest. Their business is to collect as much money through the front door and not let no money come out the back door, right? Like, that's their goal. So they will do a lot of things to make sure they're collecting your money through the front and making sure that money is not leaking out the back, right? And we're going to talk about that, especially when we talk about authorizations, especially when we talk about claims and making sure you're taking advantage of it. So let's talk about a basic actually understanding of what health insurance is. Let's talk about the three different categories of health insurance, because I think once we kind of understand the different categories of health insurance, we'll understand how one category may have more restrictions than the other, may more leeway than the other, and more importantly, may more coverage than the other. So in this country, we have three different categories of health insurance. We classify it as private insurance, that's your Blue Cross, Humana's, and whatnot. Those are your employee-sponsored insurance. So that is if you have a job and your job is providing you health insurance through their coverage, through their plan, and government insurance. And that's where like Medicare, Medicaid kind of fall under. And reason why I like to talk about that, because when we talk about Obamacare or Affordable Care Act, a lot of people assume it's this government insurance that's taken over. In fact, that was the biggest fear for a lot of your private insurance companies. Like, oh man, you're going to have this government insurance take over and they're going to drive us out of business. And so, which is why they fought it tooth and nail, right? Again, you'd be surprised the amount of people who fought the Affordable Care Act tooth and nail because of capitalistic reasons. They figure, hey, I'm going to lose a lot of money if this insurance goes into effect. And which is why some states have certain restrictions versus others to try to be more advantageous for the private insurance. Whole different discussion here. So when we talk about the choosing of the plan, those three main categories. Now, the biggest categories of insurance falls under those who are employee sponsored, meaning that your job is providing you the opportunity to get insurance through them. One of the easier ways to get insurance, because typically it is cheaper, especially because as an insurer, as an employer, you're able to go in and get bulk discounts. So the same insurance plan that you have, if you try to get that insurance plan outside of your employer, it would end up costing you more. And there's some tax breaks that the employer does benefit from, right? So it's not like the employer is doing this out of the kindness of the heart. Some may. I don't want to paint a wide brush on every employer who provides health insurance, but I will tell you that there are some companies that really benefit off the fact that they have health insurance because they're able to write off a lot on their taxes, right? So those are the three big ones, right? Talked about, the government one, right? Medicare, Medicaid, CHIP. CHIP is an important one. CHIP is for children, especially low income families. Medicare, you're 65 and up. Talk to any elderly patient who is going through the system of healthcare. They will tell you that they can't wait till they get to that age of 65 so they can get on Medicare and finally receive some of those benefits. And I can tell you there's a lot of healthcare providers who love Medicare as well, because Medicare tends to pay a little bit higher in regards to reimbursement, right? In comparison to your private insurance. Again, more of a business discussion. Today, we're talking to the patient, so it doesn't matter, right? So we have our 3 different categories, right? So depending on your advantages, depending on your age, depending on your income status, will kind of push you to one of these categories of health insurance. And the reason why it's important is because once you understand the category that you're in, you understand like, all right, these are the ways I can maneuver. These are the ways I can take advantage of my preventative health screenings. These are the ways that I understand that like, all right, if I need to appeal something, if I need to do some claims, which we'll talk about in a little bit, these are the ways I can do it because it's all different in regards to the category of plan that you're in. But remember, I asked the question, what is the most important question you should be asking? And it is not the monthly pay, right? There's a confluence of questions that you should be asking. And I want to kind of talk about them today as far as what you should know in regards to health insurance, right? When we talk about health insurance, whether it's Blue Cross, Humana, Aetna, wherever the health insurance is, a couple things you should know. Premium. What is my monthly payment every single month? Like how much am I going to pay every single month to keep my insurance plan? That is your premium. Followed by the premium, one of the questions that I know does not get answered enough is your deductible. When we talk about the deductible, the question is, what is a deductible? And more importantly, how should I frame it? Because the deductible plays a big factor in your premium, aka your monthly payment. Most people don't realize it. Most people don't really think about it until they need to think about it. So your deductible is the amount that your insurance will pay for after you pay that price, right? So let's say you have a bill that's $1,000, but your deductible is $500. Your insurance company is essentially saying, hey, once you pay your $500 deductible, once you pay that amount, then we'll decide 80-20, 90-10, 100%, how much we'll pay after. Make sure I want to stress that scenario because I think a lot of times when people hear deductible, and they hear, oh, I already paid my deductible, and then they get a bill. They're like, hold on, like I paid my deductible. Why am I still getting a bill? Your insurance company will sit on their hands until that deductible is met. But once that deductible is met, now your insurance company comes to the table and says, okay, all right, you met your deductible. All right, let's see where, will come into play. And quite often, you'll have insurance companies that will pay 80% after the deductible is met, 90% after the deductible is met, 70% after the deductible is met, which means that even after you pay the deductible, guess what? You still have some balance that you offer. That definitely trips up a lot of my patients I've had, especially when I'm doing outpatient medicine. Even now when I do my rehab medicine, because typically, they pay insurance, they pay the deductible, then they still get a bill, and they're trying to figure out why am I still getting a bill? And that's part of the reason why. The co-payment, which is very common, this is typically the payment that you pay, especially when you're going to do an outpatient visit, ER visits, whatever. This is the payment that you have to pay to the establishment, to the healthcare business with the service. So this doesn't even necessarily include a deductible. A lot of times when you go to see a primary care doctor, you may have a copay as low as $10. Like, hey, every time I go see my primary care doctor, I got to pay him $10, in cash. And then, he bills my insurance and then we work on the back end. That's typically where your copay comes in at. Your co-insurance is another conversation. Again, that is the share of cost. And this was I was kind of alluding to, right? Like we have your deductible. So we have the amount that you have to pay before your insurance company kicks in. And when your insurance company kicks in, that's when your co-insurance starts having a conversation. That's when you got to know, all right, how much co-insurance do I have? How much does my insurance cover after I pay my deductible? A very important question here. I don't want to say bigger than all, right? Because all of them got some great points that you need to really focus on. But understanding your network, like the amount of people who they may stay right next to their doctor's office, they may stay right next to a hospital, get an insurance plan, only to find out that doctor isn't in network, that hospital isn't in network, their favorite pharmacy isn't in network. So what does that mean? That means that hey, your insurance company has, came with a little contract to say, hey, I'm going to go to Dr. A, I'm going to go to hospital A, I'm going to go to pharmacy A. But you live around Dr. B, pharmacy B, hospital B. You don't even live around the hospitals or the pharmacy or the doctors that your insurance company has a contract with. But you thought that, hey, once I have insurance, I'm going to be able to just go to my doctor that I've always been going to. And that can be a very rude awakening for people, right? So I always implore, when you are choosing your health insurance plan, you almost have to have this list. It's almost like a rubric, because you understand that if you have a low premium, that may mean you have a higher deductible, aka a higher amount that you have to pay before your insurance company steps in. That may mean you have a higher co-insurance, aka, hey, you know what? The insurance company, since you're paying, this low amount, says, you know what, they'll cover 70% of the cost, 80% of the cost, right? Hey, guess what? I may not be in network with the same doctors you're used to going to, right? So these are all questions that you got to ask yourself, like, okay, what is important to me? Is it important that I have my doctors that I'm used to going to? Is it important that I'm able to go to the hospital I'm used to going to? Is it important that I have a low deductible amount? Is it important that I have a low co-insurance amount or high co-insurance amount, depending on where you want it? Like, is it important that my premium is low month to month? These are extremely important questions that you have to ask yourself, right? So make sure you write this down. I know, especially my podcast listeners, I know you're getting it down. Make sure you get this down, because those 5 components alone, if you have that game plan mastered, will make sure that you are not upset when a plan test isn't covered, when your doctor that you love dearly, you're not covered in them, when you get this surprise bill after an ER visit. Like, you want to make sure that you are in control, because especially now that they took numbers from about 2022 per Kaiser Family Foundation, 92% of people are insured in this country. 92%. So again, shout out to Affordable Care Act and Obamacare, because that was not the case. So we have a lot more people who are in the business of being insured than we did before. But that doesn't mean we have a lot more people who are informed about the business that they're in, if you understand what I mean. Like, how many people want to go into a business that they're not informed in? Not too many. So we have a lot of people who are now in the system of healthcare and are getting rude awakenings left or right, because they just didn't know the questions that they had to answer. So I hope like that section was extremely important to you, because I think if you can understand those 5 pillars, things become a lot easier, and your healthcare and the way you interact with the healthcare system becomes a lot more of a fruitful relationship than an adversarial relationship, which a lot of people can have. All right, so how do we maximize the coverage that we do have? Whether it's on the private insurance, whether it's an employee sponsor, whether it's the government, Medicare, Medicaid chip, how do we maximize it, right? And this kind of goes back to last week's episode. One of the first things you got to do is you have to take advantage of the things that are free. There are a lot of things that are free when you have health insurance. We talked about the preventative health services, your wellness exams, your wellness checkups, your colonoscopies, your mammograms, we talked about depression screens, obesity screen. We talked about a lot of tests that are covered because you're insured. But how many people recognize that there are a lot of ancillary services that are also covered under your health insurance plan that a lot of people don't take advantage of? A lot of people don't realize that a lot of gyms will give you discounts when you're insured. You can have a health insurance plan and say, hey, I want to go to this local gym. How do I get it so that you guys pay for it? A lot of times your insurance company will give you discounts for going to the gym. Why? Right? Again, they're not doing it at the kindness of the heart. Some may, but most not. They're doing it because they recognize that, hey, if I have a person who is healthy, who is taking care of themselves, guess what? They are going to use our system less as when they're sick, and that's going to save us more money, aka that's going to make sure less money is going out the back door. So of course they're going to pay for your gyms. There are a lot of health insurance companies will offer dietitian services where you can, meet with a dietitian, meet with a nutritionist, again, to try to get you healthier, eating healthier, aka save them more money, right? There are a lot of things that the health insurance plans will do to make sure that you are as healthy as can be, because a sick person is a costly person. Think about that. If you are sick, you are going to cost your health insurance plan more. If you cost your health insurance plan more, that's less money they make on you, right? It was one of the big reasons why they were fighting against uninsured people getting insurance, because they figure, we're going to get this huge influx of people who are sick, and we're going to have to spend money that we didn't have to spend anymore, because the only people that we were taking were people who were pretty healthy, and they really didn't use our services, right? So again, it's one of these capitalistic opportunities where we have to take advantage of as the patient. So as a patient, we have to say, hey, do you cover gym memberships? Hey, I want a nutritionist. There are some insurance companies that, especially if you go to their website, they have they gamify the system. So they even have point systems that says, hey, you know what, if you go to the gym and you see our nutritionist and you talk to our dietitian and you do your wellness checkups, we'll give you bonus credits at the end of the year to apply towards your deductible to apply towards your premium to try to save you some money. Because if we save you some money by getting healthier, guess what? You will save us a lot more money by not having to spend money on you being sick. So it's extremely important that when we have these plans, we have to maximize everything out of it. Because if you don't, you're just leaving essentially money on the table. Like a lot of you are going to the gym who have health insurance and don't realize that your insurance may cover that gym. Now, they may not cover the specific gym that you're in, but they may cover a local gym. So I want you guys to make sure you're taking advantage of everything your insurance plans has to offer. And if you don't know what your insurance plans have to offer, give them a call. You should not only be calling your insurance company when you have a problem. We're going to talk about that in a little bit. You shouldn't have to only call them when you have a problem. Say, hey, by the way, I just want to make sure I'm taking advantage of everything and all of the benefits on my plan. Could you let me know what my benefits are? Because I know, and if you've signed up for health insurance, they give you like this PDF, 10 plus pages of things that, hey, welcome for buying our insurance. Here's your benefit. 9 times out of 10, most of y'all not reading that. Again, I know, right? I'm on the other side too, right? I'm on the side where I'm probably not going to read this 10 pages of stuff. I just need to know, do you cover the big things? I usually, Yep. Glasses. Yep. All right. Kid stuff. Yep. All right. We're good to go. I just need to know that more than anything else. So you have these plans that are making sure that they're trying to put money in your pocket because they're trying to save this some money. So make sure that we are taking advantage of all the extra benefits in our plan. Making sure, again, we talked about the network aspect of it. Staying in your network, because staying in your network saves you money. The reason why they want you to stay in your network because they already have contracted prices to this doctor, to this facility. And if you go to a different facility, to a different doctor, guess what? Now you have to get billed as an out of network fee, and that could be very costly. So making sure you're staying in network, which is why it's so important, right? If network is big for you, right? Like if you have to go to this specific hospital, if you have to see the specific cardiologist, make sure that that person is in your network before you even choose the insurance. And most insurance companies will let you search to say, hey, these are the facilities we cover. This is the doctor I'm contracted with. Most insurance companies will let you go through that process before choosing them because they want to make sure that you got the right choice, right? So be very understanding, right? And I want to make it clear, right? Because you may have your favorite doctor who takes Humana, but the type of Humana you have, they don't take. So you got to be very specific. Say, hey, I'm about to be on Humana Platinum, right? Do you take Humana Platinum? Call that office. Say, yes, we take Humana Platinum. Okay, I can go, right? I've ran into that a lot too, where a patient thought they were on my plan only to find out that, yes, I'm on Blue Cross, but I don't take that type of Blue Cross. I'm sorry, I take the other type of Blue Cross because there's so many out there. So making sure you're maximizing your coverage with your visits, your preventative health services, making sure you're taking advantage of the ancillary services that your insurance company provides you with, like nutritionists and dietitians and gyms and everything else under the sun, smoking cessation, alcohol cessation, all the therapy, all of this stuff under the sun. Make sure you're taking advantage of that. Making sure you are staying in network to save you some money. And if it save you some money, guess what? You're going to save the insurance company some money, and they love you when you save them some money, right? So these are all things that we have to think about when we are trying to maximize our coverage for our health insurance plan that we just spent a good time breaking down the 5 pillars of importance, making sure I got the right one. So let's talk about the common pitfalls associated with health insurance, right? And I think the biggest one, obviously, if you're watching this, listening to this, is not reviewing the plan, not having a game plan before you get the plan, I think is the big one, right? Because you have to understand, does this fit my deductible, criteria? Does this fit my network criteria? Does this fit my co-insurance criteria? Does this fit my premium criteria? These are all different criteria that you got to have lockstep and key before you go reviewing the plan. And many times we are choosing insurance plans based off the wrong rubric, right? We thought like I only cared about making sure my premium was low, only to find out my deductible is so sky high that it doesn't matter, right? I really don't have insurance, right? And that's why I talk a lot when we mention people who are underinsured, right? Because they may have some type of insurance coverage, but the rubric that they're in, the type of plan that they're in, makes it so that they almost can't use it. Like they got a plan that is dirt cheap per month, but their deductible is so high that anytime they need any type of service, they got to pay for it out of pocket anyways, which means they end up not getting it, right? So it's extremely, extremely important to make sure we are reviewing our plan. I think another pitfall, ignoring the preventative care. It's right there. It's free. It's like free. Like, why are we ignoring the things that will not only hopefully save us some money, save the insurance company some money, save us some money, but help us live long, right? So we ignore our preventative healthcare plans. There's a lot of people who walk around with insurance and can't tell you the last time they had their wellness visits. I don't understand it. It happens all the time. It's mind-boggling to me, but it happens, right? So making sure you take advantage of all your preventative healthcare services at your age, whatever the age is extremely important if you're going to take advantage. Remember, my job, especially here in the Lunch and Learn community, is to help you take advantage of the system for your own good. Empower yourself for better health. If you want to think like a doctor, we have to make sure you are taking advantage of the system at hand. And you cannot do that if you're not reviewing the plan. You cannot do that if you're not taking advantage of your preventative healthcare measures, right? You can't do that, right, if you're not taking advantage of these ancillary services out there. Like, you gotta do those things. These are like the two biggest pitfalls that I see run into with my patients, is that they're just not taking advantage of what's in front of them. They're not getting their preventative healthcare services. And more importantly, they're not reviewing their plan to understand, hey, what does this plan offer me? Does this benefit me? Does this benefit my family? Right? Am I going to get more positive good out of this plan than my insurance company? Like, that is what has to happen if we're going to take advantage of our insurance, if we're going to maximize our insurance, if we're going to choose the right insurance. Now, this is one caveat that I just wanted to touch on, because I think it's not something that comes up a lot, but it is something that when it comes up, I think patients need to understand what rights that they have. And this comes when, your insurance says, you know what, we're not going to cover that, right? We're not going to pay for that service. And a lot of times your doctor will say, hey, my insurance company denied the procedure, right? Like that plan. And a lot of times people feel stuck. They feel like, oh, okay, insurance denied it, there's nothing I can do, which can be farther from the truth. For a little bit, I just want to kind of, give some pointers on what I've seen work for my patients and what you should be taking advantage of, right? Because I can assure you, your insurance company's job is to make sure money is not leaving out the back door. That's your insurance company's job. How do I make sure that less money is leaving out the back door and staying in my pocket? So a lot of times when you hear that your doctor say, hey, your insurance is not covering this procedure, you know what it is? Your doctor submits a claim and say, hey, I want to do procedure X, right? Whatever the procedure is. And based off an algorithm, the insurance company's computer, AI, will be like, nah, we're not accepting that. And just quick deny it. And your doctor is left with like, oh, they denied it. And you're thinking that some person on the other side, reviewed your chart, reviewed your medical history and said, based off my, clinical judgment, I'm not going to allow. No, it's a computer. It's a computer that says 1, 2, 3, nope, fall off, deny, keep it moving. So what should you do? First things first, right? You have to say, you know what, doc, I need this procedure, so we're going to appeal it. And I can tell you, your insurance company hates the word appeal. Your doctor may hate the word appeal too, but your insurance company definitely hates the word appeal, because a lot of times the appeal starts with the healthcare provider. I know I'm telling on my healthcare providers, but a lot of y'all are sometimes lazy, right? A lot of y'all are telling your patients that your insurance company denied it and there's nothing you can do about it because you guys don't want to go through the process of having to go through an appeal. And as a doctor, outpatient, inpatient, rehab, I go through appeals on all different levels of healthcare, and they all kind of start the same, right? They all are kind of in that same window of, all right, Humana's not covering this procedure. All right, let me call this number, right? All insurance companies have this appeal hotline. I call the plan, say, hey, you decided not to approve my procedure for my patient. Who do I need to talk to? Because you're just, right, at this point, you're just talking to a customer service. So typically, the customer service say, okay, times are good for you, Dr. Pierre. And I say a time. And they say, okay, we'll make sure one of our clinicians or clinical providers calls you during this time frame. So now you are waiting during this kind of time window for someone to talk to you about an insurance plan, the insurance decision of why they decided not to cover it. Okay, cool. That happens. And when that happens, you go, okay. And a lot of times, you'd be surprised, a lot of times you're talking to a person who's not an internist, right? You may be talking to someone who's in a different specialty, but what their job is just reviewing. All they do is review. Like, in fact, we had Dr. Dooley on. All they do is review. Like, they're here to review, and say yay or nay. So now they call you, you explain the case. And quite often or not, surprisingly enough, when you actually talk to another clinician, they'll be like, you know what, that makes sense. Let me go ahead and prove it. But let's say that doesn't happen, right? Let's say you get to the point where they don't want to prove it still. Now the patient has to come in, right? Because again, the patients have their right. So now the patient is calling and saying, hey, I want to talk to the same process. Like, cause I need someone on your side to explain to me why I can't have my procedure. And quite often you'll be surprised, it's not improved after the doctor, they call it a peer-to-peer. A lot of times the patient will come in and the patient will, raise little hell. And all of a sudden they'll be like, okay, all right, we'll cover it, right? Because they just want to make it hard to get the approval because they understand that, let's say we got 100 people who have to go through this appeal process. We may approve 90% of them, but the 10% we don't approve, we may have saved us hundreds of millions of dollars a year. So it's very fruitful for them to block out that 10%, right? So they'll go through the 100 patients that they have to go through, go ahead and begrudgingly accept the 90% because they know if they block that 10%, they've saved themselves hundreds of millions of dollars a year, right? So that's just one of the things I wanted to tell you guys, because I think a lot of times we think we hit a dead end when our doctor tells us that, hey, insurance isn't covering it. And just understand that you do have rights. You do have, the ability to call on behalf and defend a decision or defend against a decision that your insurance company made. Because 9 times out of 10, the initial decision maker was some computer algorithm, which is crazy to think about. Well, probably not. All right. So again, some resources that I think should be at your preview, especially when you're trying to manage and kind of go through this process of the healthcare system. There's a lot of healthcare advocates. There's a lot of counselors, a lot of online resources. Obviously, you listen to a show like this one here. There are a lot of sources out there that will help guide you to make the right decisions when you're choosing your healthcare plan. You just got to take advantage of it, right? Before you make a decision like, hey, what am I going to choose as my healthcare, partner, right? Because that's what your insurance company is. Even though they don't want to think like that, right? Humanas and the Aetnas of the world, they may not want to think that you're their partner, but they're your partner, right? You're my partner in crime when I need my health wellness visit. You're my partner in crime when I need that imaging test. You're my partner in crime if I need surgery. You're my partner in crime. So we got to work like partners. But unfortunately, because, these big businesses are used to being the big dog in the partnership, you got to make sure that, hey, I know what I need to know to make sure that this isn't like a 90-10 situation. This is more like a 60-40, right? Like, they're going to still have a little bit of power, but you want to make sure that you got some power and leverage in this relationship of your healthcare, because it is, at the end of the day, your healthcare, your life. At the end of the day, right? Making sure that you're taking advantage of any healthcare advocates out there, any online resources, again, show like mine, just to make sure that you are asking the right questions. Again, I suggest you go back to that section of what are the 5, aspects of healthcare plans that you need to know, that you need to have in your rubric when choosing the right insurance plan. Extremely, extremely important. I've seen too many people on the other side who didn't ask the right questions, who didn't take advantages of the services, who didn't recognize, hey, my insurance company will pay for my gym, who didn't recognize these things here. And I seen them get burnt for it time and time again. And they usually don't recognize they're getting burnt until they need it. Until you need a procedure, that's all of a sudden you realize, like, whoa, hold on, y'all don't cover that? Until you need a procedure, that's when you realize, like, hold on, my doctor's not in my plan anymore. Like, I don't want you to go through that, right? Go again, think like a doctor, empower yourself for better health, right? I want you to make sure that the decisions that you're making are so informed that you can't wait until it's time to sign up for insurance again, because you are ready to take advantage of every single thing that they offer for you, whether it's private, whether it's employee, whether it's one of these government insurances, whatever it is. There are advantages and disadvantages to all of them, but I want to make sure that you are taking advantage of more of the pluses than the minuses. I'm yours truly, Dr. Pierre. I'm going to see you guys next week.